Morning out there in Denture land and world, along with Lyme and MS. I am back to discuss a little bit about yesterday's appointments, because I said I would do a follow-up. I got into the dentist's office at 10:30, and I sat for an hour and started getting fidgety, went outside, came back in. Finally, they called me back into the room. I sat there for a little bit. The dentist came in and I explained I had to tear the reline out so I could talk. At least some of it I did. So he said this time he would take and make it thinner. And I was all good with that. Then he walked away with the teeth and I sat there for another hour. So while I was sitting in the chair, I started getting the numbness here and the dry eye, which is usually the sign that I'm going to get one of the little mini pseudo exacerbations. So I got myself up and I turned sideways. So I was sitting in the chair like it was like a desk chair rather than a dentist chair. So he came back in and said that was fine, whatever made me comfortable. And he took the dentures and he put the soft reline in, and I had to hold them like this because I have no bottom teeth back there after those extractions. So I had to push here, and I made sure that I pushed really well so it was touching the roof of my mouth. So after 10 minutes he came in, he says, "How does it feel?" I said, "Great." So he took them and he microwaved them and trimmed them down, and I walked around outside for about 15 minutes and came back in and they fit perfect. On a sad note, he had to back my extraction date for these back 3 weeks, and sadly that doesn't work with my DJ schedule because I have a party that I have to do that Saturday and I am worried that it's going to give me an exacerbation. So I said, can we do anything earlier in the month of August or after that? So I'm just awaiting a call. So the dentist appointment went well yesterday. I went to lunch with my daughter for an hour because I had an hour to spare, and then I went over to my doctor's. That wasn't as good. At any rate, I went in there and he did some things and he had to fill out paperwork on me, and he says, "Well, I'm not sure what to write here." He says, "Because I don't think you have MS or Lyme. At least I don't have proof of it." Okay, great. So what now? You know, I said, well, time for change doctors again, and I really despise change. That's why I kept my first doctor for 5 years. I kept him for a year and a half. I really don't like change. Once I get comfortable with somebody, I'm happy, I'm content. But, you know, I mean, the last time I went, or 2 times ago, back in April, after I had had the back teeth extracted, all of them, I was having serious exacerbations, and he looked at me and he clearly stated, "This is definitely MS. And you look exactly like my patients that come in here and are, you know, in the progressive stages." Which, you know, after 20 years you might think. And then I stated, well, I'm still saying that it's Lyme because I did have that tick bite here, I did have that ring, I did have that rash on my back. Nah, you don't have that. Really? I'm not one to screw around with when it comes to conspiracies because, you know, film is crappy and lousy. I mean, I hold no punches. I have no problem telling somebody you're full of SH, you know, Well, at any rate, he says, "I think this, and I think this, and I think that." And I said, "I think it's time for a new doctor." How can you tell somebody they don't have Lyme when they've had the ring and they've had the rash and the whole 9 yards and have progressively gotten worse over that many periods, you know, of time? Well, his reply to me was, "Well, if it had gone to your brain, you wouldn't be sitting here talking to me right now." Really? There's one for the medical records, huh? So anyway, you know, like any other Lyme person or MS person, they're told, it's anxiety. I said, let me tell you something. I've had anxiety since I was 13. So we've got 23, 33, 43, 44, 45. So that's 32 years with anxiety. If I don't know after 32 years what a panic attack feels like, I may as well give up. I said, it is not anxiety. I said, anxiety to me, when I have it, is like an agoraphobia. I need to escape. I need to get home. I do not have panic attacks at my house or anything like that. I said, this is not anxiety. So every time I go outside and it's hot, I go into a panic attack? Come on. So then he proceeded to tell me, well, you know, anxiety does strange things to the body. I said, oh, okay. So I have dental work done, and then I can't walk for 2 months afterwards. I'm pushing around a chair with wheels or using canes to walk. My legs are jumping. I can't think straight. My speech comes out slurred. And it lasts for 2 straight months. Anxiety for 2 months. He says, well, I have a doctor friend who made over $300,000 a year, and she had to quit her job due to anxiety. Her legs didn't work. Then maybe she doesn't have anxiety. Ever think of that? Maybe there's a root cause to it. So, anyway, I won't go on with the boring details because, like I said, if there's nothing nice to say, mum's the word. So I got up, and he says, well, I'm going to refer you to psychiatry because maybe you have some psychological things going on. I said, you're right. I do. I'm depressed because you people can't figure out what the hell's wrong. So I went out to the desk. I made an appointment. I said, I'm not going all the way to Utica. And I said, when I went and applied for disability a couple weeks ago, they sent me to a psychiatrist. She had me in there 10 minutes and said, you don't need to be in here. Psychiatry doesn't seem to be your problem. So, I'm going along with it. I'm going to go over and see the psychiatrist over in Herkimer. And hopefully they forward that information back to the doctor after I get done with my visit. And just, you know, I'll go from there. But when I did get home, I didn't put up with that crap. I immediately called a doctor who's in the vicinity of, within, you know, a 20-mile radius here. Actually 15 miles. And she's a general practitioner, but she's also an alternative doctor. Right up my alley. And her daughter has had Lyme disease. So, she knows what to look for. I have a friend who goes to her, and she's also a receptionist for another doctor's office. And she says this doctor is great. And she says, you know, she doesn't give medicines, you know, I mean, unless you really want it and you really need it. And she says she tries to use, you know, more of an herbal approach to things, which, hey, I'm game for that because I am petrified of taking any kind of medicine because I am hypersensitive. So I called the office up and I kind of broke down on the phone a little bit because, you know, there's really no openings until November. And I said, I just don't know what to do. I said, and your doctor there, he has 5 stars according to the internet, and everything I've ever heard about her has been phenomenal. So I am looking at that route. They are sending me paperwork in the mail, and I guess the doctor is going to go over it and see, you know, what I need to be seen for or whatever, and then they're going to schedule a date sometime in November, which is absolutely fine. Until then, should I have problems after having these back teeth extracted, or these front teeth, excuse me, extracted, what I'm going to do is I'm just going to go to an emergency room. I am not going to set up a doctor's appointment with Slocum Dixon anymore. See, I'm stumbling over my words already today. Anyway, I'm not going back to Slocum Dixon anymore. I've had it. I've not had any good experiences with them. The only thing good that I did have through that office, and I don't mean to cut people down or businesses on the internet, but I'm being truthful. The only good that came out of that place was I had 13 tubes of blood taken one time, and we know I don't have myasthenia gravis and the list of a bunch of other things. I'm not deficient in this or that, although they do say take vitamin D when you have these problems. So anyway, I won't keep going on. I hope you guys have a wonderful week. I'll probably be posting something soon. Tomorrow I'm going to be a little busy because it is my daughter's birthday, and she turns 10. And instead of taking her to water safari like I have for the last 2 years, I think we're going to go to the beach. So, And I hope everybody has a great day. Keep cool if you're out there in the hot climate. Lots of water. Thanks for watching.